Okay, we're gonna go through today kind of a intro to chiropractic care and what to expect when you first come into our office. If you've never been to a chiropractor before, a lot of times there's anxiety on what in the world does a chiropractor do and is he gonna hurt me when I go. So our normal protocol is when you come in for your first visit, we're gonna do an initial history and exam. The history is to figure out what you've been dealing with, your past health history, anything pertinent to you and your health. Then we're going to run through a really thorough exam and try to figure out exactly which tissues or joints are damaged, what spinal joints are restricted that we need to work with, and get you figured out with what we want to do for you. Sometimes that requires imaging, sending for x-rays or potentially MRIs if there's certain red flags that show up. But in general, once we have all that figured out, we're going to start working on the joints of your spine. We also work on knees and ankles and shoulders and wrists and anywhere there's a joint. But chiropractic care, we really want to get things freed up and moving properly. So your joints can get restricted and kind of stuck in position where they're not freely moving. And that can affect the tissues attaching. It can affect the nerves that are exiting from those spinal levels. Sometimes you have curvature in your spine that really affects muscle attachments, and all of that can cause aching or spasm or sometimes acute injuries. So with chiropractic care, our most common form of treatment is it's called an adjustment, where we lean in and do a little thrust into the joint. We find the restricted areas and we just have you relax and we lean in and we just do a little push, and Ashley just released right there. So it makes a nice crunch or a pop. That's nothing to worry about. That's just gas pressure. And normally chiropractic adjustments are very comfortable and feel fantastic. Did that hurt you at all, Ashley?
No.
No. It made a big old crunch, but again, that's just gas pressure releasing out of the joint. So usually, we'll be palpating and feeling along to find where those joint restrictions are. And when we find them, we'll have you relax and then we just lean in and do a light little push. Sometimes it's super light, sometimes we have to go a little deeper. And then with some patients, we don't want to do that. Okay, either it will hurt, it'll be too sore for them, or they're too damaged, that's too much to do right then. Or if they have severe osteoporosis, we don't want to do that. And then in those cases, we'll use little instruments, little clickers like this, a handheld clicker. I have tools over here that we can use that are more electronic, and we have different heads on these that we can put on the body and just stimulate motion in there. Does that hurt at all, Ashley?
No.
That's very comfortable and stimulates motion. So we use these on people that are really, really hurt, and we don't want to be pushing on them very hard at all, or elderly or kids, little kids. So it's not all about popping and pushing all the time. Okay, so that I just showed you a thoracic or upper back one where we just lean in, we find the angle and do a nice little push. We're very specific. This is not something to be doing at home on your siblings or a loved one. We spent a lot of years in school, it's 8 years in school, to learn the angles of the joints, how deep to go in. We learn all the anatomy. When you don't know that, you can hurt somebody if you just start pushing on them. Okay, so I'm going to show you a general normal low back adjustment. So Ashley, lie on your right side. So the low back, the vertebrae down there are a lot bigger. The joints are a lot bigger and there's more movement down here. So with this, I'm going to roll her, and I'm just going to lean in lightly like this, and from there it's just, I find my angle that I need, and it's a nice little push through there. I don't know if you heard that on the camera, but big old shift. And sometimes those look like I'm putting a ton of force, but it's not much force at all, and it's very, very comfortable. A good example of force, if I take my finger and try to extend it, that's as far as I can move that finger on my own. But really, with a little help, that finger can go way the heck back there, right? So when I'm rolling you in, sometimes when you watch someone get adjusted, it looks abnormal, like, man, you're taking them way over. But that's because the joint is super flexible. And then we find the restricted spot and just go through it really fast, short and fast. Okay, so we do that all through the spine. We do it in the neck. We can do shoulders, knees, ankles, anywhere there's restrictions, and get things lined up and moving properly, and it just frees the body up, get your body communicating properly, and really helps heal quickly.